Welcome to Discovering Africa Through Technology, the podcast series that showcases the brilliance of Africa's great minds, innovators, and experts as they tackle complex challenges with homegrown solutions driven by knowledge, technology, and innovation. Our podcast is inspired by the African Union Agenda 2063 Aspiration 7, which seeks to rebrand Africa and change negative narratives and perspectives through science, technology, and innovation. We believe that Africa has the power to solve its own development challenges and become a strong, united, resilient, peaceful, and influential global player and partner. Join us as we explore the transformative potential of technology in Africa with your host, Razia Kulatain Mwanga, and learn from the experts driving change on the African continent.
This month, we are marking Cancer Awareness Month, especially breast cancer. And today we are privileged to have Dr. Sarah Maongezi talking to us and sharing her experience. Welcome, Dr. Sarah.
I'm a medical doctor and a public health specialist. I'm 64 years old. I worked with Ocean Road Cancer Institute, which is the only center, the cancer center in Tanzania. Worked there for almost 13 years. And then I went to do my public health. When I was at Ocean Road, I was just a medical doctor. And then I went to do my public health specialization in Melbourne, Australia. I came back. I took a leave without pay. I worked with the Medical Women Association of Tanzania as the first executive director for almost 3 years. And then I went back to the ministry. I was a focal person looking after all cancer issues in Tanzania. I worked with State House with the former First Lady, who is Mama Kikwete. So I introduced cancer issues in that foundation. It was called Duama Foundation, Wanawake na Maendeleo Foundation. And then I went back to the ministry where I retired. Before I retired, I used to be a focal person with Tanzania Comprehensive Cancer Project, which was being implemented by the Aga Khan Hospital. So while I was at the ministry, I used to attend their meetings. And then the last time I went, I said, okay, guys, I'm retiring, so you'll be having another focal person. They offered me a job with TCCP. So immediately after I retired in January 2021, I was employed by Aga Khan Hospital. So the project was for 4 years. And fortunately enough, we got another funding and we introduced the cancer project across East Africa. So we're implementing it in Tanzania, Kenya, only in Mombasa and Kisumu. It's a project from 2025 to 2029. I'm the project lead for the East Africa Comprehensive Women Cancer Project.
Oh, thank you, Sarah. Can you tell us more about this comprehensive cancer care project? What does it do?
It had 4 main components. The first one is to improve infrastructure, oncology infrastructure, in terms of renovations of cancer centers, building of cancer centers, and definitely procurement of equipment, the cancer equipment. So we were lucky that at Aga Khan constructed a very nice and beautiful cancer center. If you happen to come to Dar es Salaam, it's just beside the Aga Khan Hospital, using the funds. And we procured several equipment and distributed not only to the private hospitals, but also the government, because the project was working in 2 regions, in Mwanza and Dar es Salaam. And we were working with 2 private public hospitals, which is Ocean Road Cancer Institute and Bugando Medical Center. By that time, they were the only facilities which we are attending to cancer patients, including Aga Khan. So we distributed a very nice and sophisticated ultrasound machine at Ocean Road, and we gave out a mammo machine in Bugando. We also gave out some treatment equipment such as cryotherapy, machines for the treatment of early changes of the cervix, infusion pumps, but we also gave to other low-level facilities. The second component was capacity building. So the project gave training education to these 2 facilities, but also to the lower levels, to the healthcare providers, in terms of cervical cancer screening, breast cancer screening, and prostate cancer. We were able to train almost 364 healthcare providers across these facilities. The third one was community engagement, which means it's cancer, cervical and breast cancer screening. We were able to screen more than 734,000 people around these two regions, Dar es Salaam and Mwanza. As we were concluding the project, the targets were a bit low, so we were allowed to go to any region across Tanzania. That's where we got the 734 women who were screened, and 33,000 were able to be treated across these facilities. And the last one was research and partnership. We were able to give out seed money to 9 not very high level people, but we call them young researchers, because we realized that most of the researchers in cancer in Africa are being conducted by professors, or we depend on other research from outside. So we needed Tanzanian context young researchers. And thank God, out of the 9, almost 6 of them have already been published. So it was a very minimal seed funding, but they could do some research in a Tanzanian context. And we made sure that this research cut across the continuum of care. So it was about prevention, early detection, treatment, palliative care, and survivorship. Our funders was AFD, which is Agence Française Développement. It's a French development bank. And having seen the success of the TCCP, the Tanzania Comprehensive Cancer Project, they wanted us to continue. Of course, the funding, they didn't have a lot of funding, so they went around and tried to convince other donors. Thank God we got Gates Foundation, who agreed to add up on that on the funding which we are going to get. So we got 10.2 million euro, but with a condition that we have to expand. We kept the Dar es Salaam and Mwanza, but we added Shinyanga, Dodoma, Arusha, Kilimanjaro, and of course Zanzibar. But again, they wanted us to cross border. So we also included Kenya, but only Mombasa and Kisumu. And the components remain the same, but we added the human papilloma virus vaccination. So this was the prerequisite from Gates that we should also do the HPV vaccination. In these 4 years, we intend to get almost 7.4 million to create awareness and screening and everything, 7.4 million people within these 4 years of the project and with these objectives. The actual implementation started in August. In Tanzania only, we have already vaccinated almost 33,000 young girls, 9-year-old girls, and we have already screened almost 9,000 women, eligible women.
I was recently talking to surgical oncologist, and the things that he brought were most of these cancers, the cancer situation in Tanzania, most of it is not early detected. And he talked in terms of yes, they have people, but most of them, they have general capacity, the medical experts, but also they do not have equipments to go and screen these people. So you find that instead of people coming early to be detected, they come back when cancer is about stage 3 and stage 4. You have talked extensively about this project that you've been working on. What can you say in terms of reaching out to more people and giving these services to more people?
I think, as you correctly said, we have a lot of gaps in terms of screening and awareness, access to health and the health system gaps. So if I may say about awareness, many women have very low knowledge of risk factors and early signs. That's why the surgical oncologist mentioned about getting very late stage women. And there are a lot of myths and misinformations. So many women believe myths about the causes and treatment of breast cancer. I mean, they don't know. But there's also a low awareness in participating in screening. So I read one journal which says in Tanzania, only 5.2% of women aged 15 to 49 reported ever receiving breast cancer screening. But this is not because of that of the person. It's not individual. So it encompasses also access to screening, diagnosis and treatment. The screening coverage is very low. We do the organized screening. So you get to the facility, you don't you ask for screening. Somebody doesn't even know that how to do the breast cancer screening. That's the healthcare provider. That's why we usually train these healthcare providers before we go for screening, and we use them in our screening campaign so that whenever we go away, it is sustainable. We leave somebody who can continue with that activity. But unfortunately, also many facilities they lack pathology equipment, and pathologists are very few in Tanzania. So there's delays in diagnostic and confirmation. Treatment access is limited. Thank God nowadays we have Bugando, we have Aga Khan, and the country is extending these services to Mbeya, Dodoma. But initially it was only Ocean Road, and at least Bugando came on. And now we also have KCMC, Kilimanjaro Christian Medical Center. But there are also some other health system gaps and policy. We have lack of organized screening programs, as I said before, and the lack of equipment. But data for cancer is also an issue, and human resource, of course. Whenever we go, we don't intend to get the sick women. We intend to screen them so that if it's just starting, maybe the cervical cancer is just starting, we can capture that disease at an early stage, and usually work with a cryotherapy or thermoablation, and we treat immediately the disease. Still have these gaps in terms of systems, social, cultural, economic barriers, the cost of traveling to the facilities, and so on and so forth. But we still need to talk to these women. So whenever they get this opportunity, they should come forward.
So in Tanzania, what is the best practice? Is it every woman gets screened, or do when we talk about cancer awareness, there is a certain age concentration? Let's say like this, from this years to this year, that is where more concentration is. Or is it for everybody else? Because you know that cancer affects everybody else, but there are those specific groups that are more prone to cancer. So how is the situation?
We're still not there, but we are trying nowadays. I was talking to some people saying that even in our medical schools, I mean, cancer is just a topic. I mean, you read cancer, and it passes. When you get to the field, to the actual implementation, you get to the hospital, somebody doesn't know even how to screen. So what I can say is it has to start from the medical school. It has to be a topic of which can be examined, and somebody passes, and because now breast cancer is rising very badly. I mean, if we talk to somebody, they'll just say, my friend, my auntie, my grandmother has passed on because of breast cancer. So we really need to concentrate first of all at the institutions, academic wise, but not only at the institutes. I think it should start from the primary schools, because as I said before, now we are doing HPV vaccination to a 9-year-old girl. It should start from there. We should talk about cervical cancer, but definitely you cannot get a woman and just screen for cervical cancer and leave her, or you do breast cancer screening. So we have to teach in totality. You do the breast, and you teach the cervix and the breast. So it should start from a very early age. I worked with the Medical Women Association of Tanzania. We did a lot of breast cancer campaigns. So as we were going around, we found girls of even 18 years old who had breast cancer. So we were asking ourselves, what's the difference between the books we read that breast cancer is for old women, 50 and above, but we are meeting nowadays girls of 30, 40, 45. So that means we really need to start teaching these girls to know their normal breast at a very, very early stage, 18 years old, 20 years, 30. And then we encourage them to do, if it's below 40 years, to do echo mammo. And if it's 50 years old, they start doing mammogram yearly. Unfortunately, the mammogram machines are not all over these health facilities. That's another gap. I think we need to advocate to the government so that a woman can walk in and say, I want to be screened, and the mammo is readily available in that facility. But okay, if there's no mammo, at least a clinical breast examination. So a doctor should know how to do a clinical breast examination, because nowadays we don't preach about the self breast examination. The self breast examination is just to know your normal breast. But by the time, if you just do the self breast examination and don't go for clinical breast examination, by the time they go to the doctor for clinical and find a lump, it's already late. So an echo or a mammo would be ideal. But lastly, of course, for older women, they should do this yearly mammogram if possible. If they have the capacity, I mean, they can go to a hospital, to a facility, and do the mammo. I know the cost could be one of the things that will hinder them to do them, because the cost of mammo is a bit high for a normal Tanzanian who lives in the village. So that one also I think we need to advocate to the government so that it is subsidized. But most of it, or the final, is to have all of us to have the health insurance. So that one will really, really help us. And the national insurance should allow a woman to do screening using that health insurance. I think we need to train the community health workers. We have community health workers all over the villages, in every village. So if we train them for the signs and symptoms of breast cancer, but we shouldn't wait for them to hear about the signs and symptoms from a woman, but they should encourage them and link the women to the health facility to do screening even before the signs and symptoms. Thank you.
How much does a mammogram cost? Is cancer a lifestyle disease, or what is it? Because, like, when you talk about the statistics and what is currently happening, it seems that it's only the people who have money in Tanzania who can survive cancer, because they need to have access to hospitals, big hospitals that can do this, and also the medicine is not cheap. So take us through, if you can talk about in terms of the cost of this, like medicine and the screening, how much is it?
Screening is free, as far as I know. In Tanzanian policy, cancer is free of charge. Immediately after you've been diagnosed with cancer, then you are liable to be treated freely. But the cost is not only the drugs. Traveling from the village, somebody has 10 children, a woman has 10 children. She's the breadwinner. She has to go to the shamba, to the farm. So at times you diagnose somebody with breast cancer, she'll tell you, let me finish cultivating or harvesting my maize, then I'll go. By the time she comes to the hospital, it's already advanced. So the cost is not only the drugs. Ocean Road, they get free radiotherapy treatment. The only cost, I think, is 10,000 to see a doctor. But definitely the hospital now has a lot of women. It needs, as I said before, the government is trying to have so many hospitals, cancer hospitals, in the zonal and regional referral hospitals. So this, I think, will help Ocean Road to be decentralized. So women can go to Bugando, can go to Mbeya, can go to Dodoma, KCMC, Kilimanjaro. But at the moment, almost all come to Ocean Road and some go to Mwanza. I'm not sure about the mammo, the price of the mammo at Ocean Road, but I think there's a cost sharing because these equipment are very expensive, so to say. And if you say everything is free, definitely it's not going to be sustained. So somebody has to cost share. But the good thing is there's a social welfare office. If a woman goes there and she cannot pay completely, they go through that social welfare, looking at the criteria. Where is she coming from? Maybe she doesn't even have fare to go back to the village. So they usually help these women to get the diagnosis and the free treatment. But most of them, they cost share, but after being diagnosed. So before diagnosis, you have to pay. The private sector where I'm working at Aga Khan, so we also have some of the insurance companies, they use their own insurance, but we also have the social benefits also. There's an office there. If somebody cannot pay, a certain percentage will be deducted from that, and a diagnosis can be made and treatment can be delivered. So yes, cost is a barrier, is one of the barrier in terms of the treatment of cancer.
You talked about breast cancer being on the increase and the cervix cancer. What do you think is the reason for the rise of those cancers, and what are the current statistics of cancer in Tanzania?
The reasons are multiple, I could say. The first one, I think the knowledge. Knowledge has increased in Tanzania. People are getting out, getting screened. Technology has improved in the diagnosis. Doctors, when I was at Ocean Road, there were only 4 oncologists by that time at Ocean Road, the whole of Ocean Road, only 4 oncologists. Now there are almost 50 of them. And it's not only at Ocean Road. So KSMC have oncologists, Benjamin Kappa have oncologists, Bugando. I can say people are being diagnosed. I think the late stage is getting down because before there was no knowledge and people are coming with a very late stage. At least the late stage is going down, and we are seeing it in the survivorship program. I'm in one of the groups of the survivors. So every day you get a survivor coming, say they've been diagnosed stage 2, they are also stage 1. So you could see that at least if the number is increasing, it means people are being diagnosed early and they're living longer. Before, we used to have a survivorship group. Today, the survivor will join. Tomorrow, here, she has passed away. Or in 2-3 months, she's passed away. Technology, knowledge, and the human resource have increased. But still, the numbers are alarming. Breast cancer represents almost 14.4% of all new cancer cases among women, and is the second amongst women cancers and mortality. And most of them will die very early, as I said, because of the late diagnosis. Cervical cancer, we see almost 9,700 per year, and almost 6,000 of them will die per year. We have a long way to go because almost 2/3 of those will die every year. It is projected that in 2030, there'll be an increase of about 82%. So you can see that we really need to do something.
So why an increase? There's more knowledge, more awareness, more training of experts. People are going for testing early and treatment early. So why do you think there's this projection of increased instead of reducing cancer?
If we don't intervene, I forgot to say that. If nothing is done, if we don't intervene, the cancer will go up.
Now let's go back to you yourself. You are a cancer survivor. How did you know that you had cancer?
I retired in January 2020. In March, I joined the Tanzania Comprehensive Cancer Project. Initially, I was working with Medical Women Association of Tanzania, teaching women how to do the self-breast examination. I was also walking the talk. Whenever I go to the bathroom, I'll just palpate my breast. Unfortunately, I can say this is unfortunately, I was so busy with work, I forgot myself. I was not doing my yearly mammo. I did it in Australia when I was in Australia in 2017, and that's it. I didn't do it anymore. But in 2021, I palpated my left breast and I saw there's a small lump on my left breast, very small, like a jagere, a pea. There was a gynecologist at Aga Khan. I called her in my office and I told her, can you do a clinical breast examination for me? So I closed the door. She did the clinical breast examination. It was hard to find it. She was like, I'm not sure. And she advised me, why don't you do a mammo? I said, yes, I was going to do it because I was still on probation. I was not allowed to use their health insurance. So I was waiting for that probation to pass so that I do it. But when she told me, why don't you do it? I said, okay, I'll pay for my mammo. So I went and did my a mammo. I didn't introduce myself to whoever was doing that mammo. And the screen was on. As she was doing, I, being a doctor, I saw, oh, there's something there. I said, And she was like, what? She switched off the screen. I said, I've already seen it. She was like, what did you see? I said, okay. So what are you telling me? She said, you just go back to your doctor. Your results will be with your doctor. So I went back to my doctor and she told me, you need to do another test. I said, but you have to give me the results of the mammo. She goes, okay, it's suspicious, blah, blah, blah. So I went and did the biopsy, the colon biopsy, left breast. So my doctor got the results. Actually, he was running away from me. It's a he. So one day I caught him on the corridor. I said, are you going to give me my results or not? He goes, I've sent your results to Nairobi. So wait for maybe a week when the results will be back. So I understood because the biopsy, the results usually come in Aga Khan in Dar es Salaam. But he sent it for the immunohistochemistry. By that time, the immunohistochemistry was not being performed there. When the results came out, he told me that, yes, you have breast cancer, left breast cancer, stage 2, because we also found 2 nodes at the axilla. Being a doctor, of course, I know the journey of breast cancer. And of course, I'm a human being. I didn't believe that I had breast cancer, but here I am. So I informed my older sister and I told her, look for the ways to tell my mom. My mom is still alive. She's going to be 90 years old in 1st of November. And I went straight to my spiritual father. We prayed together. My spiritual father told me, this is not breast cancer, so don't worry about it. But being a doctor, I packed my bag and I went for mastectomy. So I did my mastectomy, the removal of the left breast. This is the step where many women find it difficult. Whenever you tell a woman that you are going to remove her breast, especially in my country, most of them, they'll tell you, let me go and ask permission from my husband. Let me go and think about it. So you try to cancel and cancel until they accept, or some of them, they'll go and they'll never come back. Why? It's because they say, especially if it's left breast, they usually say, my heart is on the left. So when you remove my breast, it means you have removed my heart. So that's a myth also, which is going on around breast cancer, left breast cancer. So by that time, the PET CT scan was not yet in the country. I thank the Ministry of Health, even though I had already retired. I went to them and asked if they can support me to go to India to do my PET CT. Thank God they accepted. I went to India. They did a PET CT scan, which I thank God there was no residual cancer in the breast, in the bones, and everything. I also did the bone scan. It was okay. I did my first 4 chemos in India, and then I came back to Tanzania, finished the 12 cycles of chemotherapy, and followed by 25 sessions of radiotherapy. It was not easy, especially the first 4 chemos, but because I was in India, I went with my husband. He supported me very much. The other thing which people are afraid of is the removal of the hair from your head, being bald. So I also had that. I went with my hair, which was plaited, and they started getting off, and then I decided to cut it off, all of it. But vomiting, weakness, severe weakness, malaise. But if you think that this will pass, you get the power to move on. While continuing my cancer treatment, I was continuing with my work as an officer at the TCCP, Tanzania Comprehensive Cancer Project. I used to go to my chemo. I do my chemo. I go to the office. I finish up in the afternoon. And then after finishing my chemo, I'll come to work. I do my work. And then at 4 o'clock, I go for radiotherapy. By that time, Aga Khan didn't have the radiotherapy treatment, but now they have. So I took my radiotherapy in a private hospital called Besta, and I completed that one. That was my journey. I told my sister, you tell my sisters, whenever they come to me, they should have finished their cries at their homes. I don't want somebody coming here start crying because it will never end. I have very many sisters, cousins, brothers. So I was thinking, if everybody comes, cries, I cry. They cry, I cry. I cried for 2 weeks, and then I told my sister, whoever comes to my house, finish your cries there. When you come here, we laugh, we talk, we eat, we drink, and that's it. And that they really did what I asked them to do. And they were surprised when they came here. They found me not crying. I was happy, and they were also very happy. So I really thank them, the support, but the support from my husband also. He really supported me very much. Support from my children. I have 3 children. The elder son used to come with me to the chemo unit. He's also a doctor. He will sit beside me. I receive my chemo. I finish, then we go home. Lesson learned is first, having a family, supportive family, helps a lot in terms of cure and in terms of taking up with the drugs and everything. Number 2, eating and drinking a lot of water. When I was taking my chemo, I couldn't eat anything except water, and I'll put tangawizi in it, and that's it. I'll drink the whole day, but I'll feel fine. The next day I can eat something. Number 3, believing in yourself, because some people will break the chemo cycle. They take the chemo drugs this week. Next week, they don't come to the hospital. They'll come after 2, 3 weeks. They say, no, I was vomiting, but you can vomit the 1 week, and then you take a lot of water, take a lot of fruits and vegetables. The next week, you're fine. You get another chemo. Whom you meet after the diagnosis. My experience was not so good because I was new in the hospital. I was escorted by a certain lady to the mammo room. So when I said, and then that girl switched off the screen, and then she didn't tell me what it was. And then we went away with that escorter. She told me, I've forgotten something. Let me go back to the mammo room. Not knowing, she went to ask the lady what were the results, and the lady told her. Whilst we were walking, before we even reached to the doctor, she told me, your mom is not good. So you can imagine the bad news being broken on the way. I said, okay, yeah. So whoever you meet at the first point of contact, it's either breaks you or makes you. Again, if you meet a doctor and sees the results, and the doctor goes, oh my God, you have cancer. Oh, you know how it feels. So I think the social workers at this point matters a lot. You have a lot of social workers in Europe and America, but in Africa, I think before breaking the news or after breaking the news, it's very important to have somebody who can give you a counseling session. So I think because the human resource here is an issue, we rarely get these sessions of being counseled. So you either be counseled by your spiritual leader or your family or your husband or your children. And counseling is a talent. Not everybody knows how to counsel.
I just want to take you back a little bit. When you discovered that you had stage 2 cancer, you opted for mastectomy. Why did you opt for mastectomy? Were there no other options? You've been working in cancer, you've been helping people. So, how did that feel after helping all these people, giving all that knowledge that you were diagnosed with cancer?
I have a very experienced doctor. His name is Dr. Harrison Chua at the Aga Khan Hospital. He also worked at Ocean Road. He did counsel me on the options of mastectomy. By that time, we didn't have the surgical procedure without removing the breast. Nowadays, we have a surgeon at Aga Khan who does that without removing the breast. And because I was not sure if the Ministry of Health will give me referral to India and do the treatment without removing the breast, they only gave me because the PET CT scan was not available in the country. By that time, they would tell you if the treatment is available in the country, you cannot be given any support to go anywhere unless you pay for yourself. So I was given that because PET CT was not there. So the only option was mastectomy. But the way I understand is a certain stage of breast cancer is the one which will either allow you to leave the breast, but mine had already gone to the axilla. They had some elements of breast cancer in the left axilla. So I'm not sure if they would conserve the breast at that stage. So coming to the second question, I'm a very spiritual lady. Whenever I was posted to an institution, because I told you I started with Ocean Road 13 years. I went to Australia, I did my MPH, I came back, took leave without pay. I went to Mewata, that was cancer campaign all over the country. Actually, I started before going to Ocean Road as an intern doctor. I used to see those elderly sisters doing cancer campaign and everything. I just go there, I sit, I look, I watch, I help them distributing tea, coffee, registering clients as an intern doctor. And then I went to Ocean Road. I came back to Mewata, executive director, went around the country doing cancer screening, went back to the Ministry of Health. I was given a desk to look after cancer activities. Wherever I went for to train people, I would tell them about this journey. That I went there, it was cancer here, and then I was asking myself, and I usually spoke. I'm asking myself, is this cancer following me or I'm following cancer? So when I got this cancer, I was like, oh, I think God wanted me to do something in terms of cancer. Being here, creating awareness, advocating, helping women, I think this is a call for me and it's coming from God. That's what I believe. Why should I be treating people, taking care of, and then I get the cancer? I think God wants me to do something.
That is very insightful. You say that you had just newly been employed and you're on probation when you are doing this because you also paid for your own mammogram. So how was it working, taking chemo, radiotherapy? How is the system in terms of if you are sick in Tanzania and you are going through all this? Is there a situation where people are supposed to be given leave of absence so that they can go through this? Because also taking all this medicine and working increases also the stress level and also increases your chances of getting more sick.
I can tell you to date, I'm very, very thankful to my bosses, the CEO and the medical director of Aga Khan. Because when I got support from the Minister of Health going to India, still on probation, I thought now this is the end of me. Employed in March, in May, you're going for your PET CT scan in India, not yet confirmed. I got my tickets and everything. Tomorrow was my journey. Comes an HR with an envelope on the hand. I was like, okay, now this is dismissal or something. We are not employing you now. Your probation or whatever. Open the letter. It's saying we have confirmed you. Can you imagine, Razia? I was on tears because confirmation means I'm going to India for 2 months. They're going to pay me for 2 months without even being to the hospital. I really cried. And then when I came back, as I was doing my chemo, my MD didn't know Dr. Harrison. I said he was the MD and he was my doctor. He's a head of oncology. He didn't know that I do my chemo and I go back to work. He thought I usually do my chemo, I go back home. So one day, I told Dr. Harrison, after finishing my chemo, I said, there's something you gave me to do it. I'll complete it now. He was like, but you have just finished your chemo. I said, yeah, I usually finish my chemo and I continue with my work. He goes, no, 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 you have to go home. You have to rest. I said, okay, I'll finish this one and then I'll go home. But that was the first time I went home after chemo. But could see it's the environment, it's the people, it's not about the system. At the government, they usually give you the sick leave. But other private facilities or entities, after being diagnosed with cancer, that's the end of your work. They usually sack them, medical retirement, and so on. And I've met a lot of women who cry and say that I was dismissed. I was left by my husband because I'm having breast cancer or another type of cancer. So on my side, I really thank God for that. And the radiotherapy, yes, at the end, some ulceration because of the radiotherapy. And my MD, my medical director, told me, you stay at home until you get healed. So it's the kind of person you meet at this working place. And they didn't tell me even to take a medical leave. They just told me, you stay home, when you're ready, come back. That's my story.
Congratulations. You really had a
Thank you. Yeah.
nice support. Let's go back to the aftercare. After you said also you work with a group of survivors. Tell us a little bit about aftercare, your time, and how is the current situation right now?
I was already confirmed at my working place. After every 3 months, I have an insurance at Aga Khan. I'll do my follow-ups, medical follow-ups. I repeat the mammo, I do the ultrasounds, I do the CA, checking for the CA levels. And in this TCCP, Tanzania Comprehensive Cancer Project, while I was working with the survivors, I noticed that they had a gap in terms of what to eat, what not to eat, what to do, what not to do. Most of these women will tell me, somebody have told me not to eat meat, not to stay beside the fire, not to stand on the sun. So everybody had their own myth. It depends whom they meet. So I decided to call an expert in this. The Tanzania Comprehensive Cancer Project, it's a French funding. We were allowed to bring experts from France who can give us master classes in different topic. So I asked for a trainer to come and give us statistics about survivorship, what to eat, what not to eat. They were very good. Even myself, I benefited from them because they were talking about meat. They said, okay, meat has got iron. When you get chemotherapy, the cells die, even the red blood cells will die. So, likelihood of getting anemia, but sugar. They were told not to eat sugar. Cancer cells, they live with because of sugar. So, they were told anything which is excessive is harmful. So you are allowed to eat anything, but in moderation. So I also benefited from that, and I'm practicing that. But the most important thing is you eat vegetables, you eat fruits, you exercise a lot, you drink a lot of water. So that's what I'm doing, and that's what I'm practicing. And I'm also giving out education, but definitely regular checkups. Always follow medical advice from qualified health professionals and don't take advices from just anyone. Another myth which went around our survivors is the taking of local herbs. There are some local leaves from the sour fruit, I think, stafeli, they call it stafeli in Swahili. So
Mm.
most of these survivors were told if you take those leaves, you boil them, you drink a cup in the morning, a cup during lunchtime, a cup in the evening, it kills cancer cells. So what I learned is most of these leaves, most of these roots, yes, they are anti-cancer. But the problem is how much are we supposed to take and for how long? And most of these, if really they have anti-cancer, they really have effect to the kidneys also. So some of these women, they usually come with kidney failure. It's because they are taking local herbs. They don't know the dose. They don't know how long they're going to take it. So we also taught the women not to listen to everybody. They should hear from health professionals and not to take advice from anyone.
There are some people who talk about after they've removed their breasts, they don't have any other support. It's very uncomfortable. They put tissue, they hide from people. What about resources like supporting women who have removed their breasts?
Yes, this is a gap. I've seen it, but thankfully we have an association called Shuja Cancer Foundation. Gloria Kida is the chairperson. She's 14 years old, I think, now, surviving from breast cancer. There are some people who usually donate some of these things, but also she works with the survivors to make these prosthetics, I could say, using some cloths. They sew prosthetics. Even my first ever prosthesis, breast prosthesis, I got it from my another oncologist at Aga Khan. It was made by this knitting, and then they put some white, sort of like cotton or synthetic something, and you wear it. But definitely the bras, sometimes we get some used bras from outside. We donated also in Aga Khan. We got some used bras and these prosthetics, breast prosthetics, and we donated to, and they finished.
For what other available services are there for anybody who is listening, who is a survivor? You have been in the system and you know exactly what is happening around and what everybody
Yeah,
else is doing. So, what
yeah.
are there after cancer care comprehensive services that people who are listening and probably don't know where to go for anything? They could be surviving from breast cancer, from cervix cancer, or from any other cancer.
In this project I'm working with, we have seed funding. We call it VSLA, VCOBA sort of. It's a savings and loans activities. So we have arranged to train survivors and the people who are taking care of the survivors, the caregivers. We will give seed funding for them to learn. First of all, they have to make like a proposal, a small proposal, not really scientific. Like maybe she wants to have a garden, and she'll rear chicken, or she'll rear goats or whatever. And then if the proposal is successful, we give her the money. She does that project, and the caregiver, of course, because the survivor might be very sick. Maybe she can't do that, so the caregiver will help. And then whenever she brings back the profit she got, we give it to another survivor and caregiver. So this is the service. We will do it in these 4 years to come. So if there's any survivor who's hearing about this one, but we would wish them to be in groups. So we'll give that money in a group of survivors, not individual. So that group will have a chair, a accountant, and we'll give that to that person. She or he will be responsible for coordinating everything, refunding the money, and then we give to another group of people. We will give at least 80 groups of 6 people, I think. So it's a seed funding. So it won't be that big project.
Thank you very much, Sarah. Now, as we close up, looking
Yeah.
back at your cancer journey, all this work you've been working on cancer, you've said like if cancer has been following you, not in a bad way, but you feel that this is your call, that you need to teach people and talk about cancer. So,
Yeah.
for anybody who is listening now, we are people who have never had cancer. There are people who are taking care of people with cancer. There is
Yeah.
somebody who has just been diagnosed of cancer and they don't know what to do. There is
Mm.
somebody who is surviving from cancer, and then there is this person who has been given a diagnosis and they don't know what to do. So, your final words, what would you tell all these people listening? And also, on top of that, we can also talk to people who provide resources and people who have something to give back to the community. Lessons learned, what you can celebrate, all this process that you've gone through, and your advice to people.
My first take is anyone can get cancer. So, regardless of age, race, religion, tribe, or status, you are a doctor, you are an engineer, you are a politician, you are a minister, anybody can get cancer. And that calls for regular checkups. And my take up message is Regular checkups, early diagnosis can save lives. And the survivors, for my survivors, this is not the end of the world. So, me being a doctor, if only I know the journey of the cancer, but I'm surviving because I know it's not the end of the world. To my spiritual leaders, when you get a woman as suspected that they have a cancer, please refer them to hospital after the diagnosis, the treatment. Then you can take over for the prayers and everything. And for my government people, the politicians, the ministers, and uh, whoever, we need to advocate for prevention rather than treatment. Definitely, breast cancer you cannot prevent it, but you can reduce the risk of getting breast cancer. That means we should have a place to do exercises. We should have all those things which can increase the risk of breast cancer. We should advocate to reduce them. Alcohol use, tobacco smoking. Not all breast cancer patients have these risks I've been mentioning. People would say, why did you have breast cancer? Were you drinking? No, I was not drinking. Were you smoking? No, I was not smoking. So there's a place of hereditary. So those women whom have a family with history of breast cancer, they should have regular checkups. And lastly, to the men, breast cancer can also affect men. In every 100 women, one is a man. Thank you.
Thank you so much, Dr. Sarah Maongezi. It has been really nice talking to you. Thank you for sharing your thoughts and your heart. My takeaway is think positive. Whatever
Thank you.
results you get, you should
Mm.
remain positive, and also beware of who you share your news with, because some
Yes,
people would break your heart than
yes,
encourage you. They will fast track you, dying faster than getting healed. And
yes,
also support for cancer survivors, because this is a
yes,
very hard disease. The process one goes through, the mental, spiritual, financial, economically, socially, some things you cannot talk about, but the pain that you go through, the after effects of the cancer medicine, it's very hard and tiring. So we need to support people, we need to encourage people, whether you have family history of cancer or not. Regularly check your breast for cancer. If you find anything you are not sure of, don't keep quiet. Follow up and follow up. Don't give up until you find a
yes.
solution. If this person discourages you, look for a second opinion, because that might save your life. So until next time, this has been your host, Razia Kulatein Mwawanga. Thank you for joining us, and thank you so much, Sarah Maongezi, for your time.
Thank you very much, Razia. Thank you.